Okay, so last lecture we have been talking about blood and blood cells, and we finished a topic about erythrocytes and thrombocytes, hemostasis question. Today we will talk about leukocytes, a white blood cell, and also after we will have topic about immune system and blood group. Second, our topic for today, it will be some part of cardiovascular system. So, leukocytes or white blood cell. If we are talking about normal quantity, we should say that for leukocytes, we have 49,000 per 1 cube millimeter, or if we calculate for liter, it will be other quantity. Leukocytes, these achromatic cells, they time of their living 17 days, or from 17 days, but some cell they are able to live decades even. They are formed in the red bone marrow, spleen and lymph nodes. Better to say that in the spleen and lymph nodes happen matter of the cell. If you're talking about destroying, they're also destroying in spleen, liver, and in the place of inflammation. Important moment that this type of cell with nucleus obligatory. The main function of leukocytes, it will be phagocytosis. Phagocytosis is this process of absorption and digestion various microorganisms which enter the body. The most leukocytes are called phagocytes. If we will talking about different types of leukocytes, we should say that all leukocytes divide on phagocytes and a cell which produce immunoglobulin or antibodies. For normal healthy people, what you can use in every day of your life experience, in your future work also, because doesn't matter your specialty, you should understand about general blood test, and also you should know what does it mean leukocyte formula. A leukocyte formula helped for us for understanding main state, main situation with human body. For example, all leukocytes we can divide for granulocytes and agranulocytes. Granulocytes, we have with you neutrophils. This is 60–70% of all leukocytes. Eosinophils, 1–4%, and basophils normally should be absent in peripheral blood, or maximum is normal 0.5%. Agranulocytes, it will be monocytes and lymphocytes. What is important here? Why I say that we can, it's so useful for our life, for understanding what is going on with our body, with our immune system. Because if we will make our leukocyte formula, we can find next thing. Neutrophils, they're responsible for bacterial infection. And when we have increasing of neutrophils, this time we are talking about presence of bacterial infection in our body. Eosinophils, they're responsible for parasitic infection and for helminthosis. Also, they can be increased during allergic reaction. So, first of all, when we see in our peripheral blood increasing of eosinophils level, first of all, we should thinking that maybe in our body we have helminthosis. Basophils, they are responsible for allergic reaction, and they are increasing in case of allergic reaction. Also, eosinophils and basophils could arise, their quantity could arise together. It also can testify about allergic reaction, but sometimes this allergic reaction can be present for because of reason helminthosis also. By the way, one more important thing that neutrophils, we can have two types of neutrophils, like with stick-like nuclei and segmented nuclei, or non-segmented and segmented nuclei. Why is important also? Because when we are talking about non-segmented nuclei for neutrophils, it means that these new one cells and their norm less than 5% in case of norm. If their quantity is increased, it means acute inflammation, acute bacterial process inside of our body, acute infection. If we are talking about increasing of segmented nuclei neutrophils, it means that this infection is long time, some period inside of our body, and we can talking about chronic infection process. Agranulocytes, it will be monocytes and lymphocytes. Interesting that their quantity is increased in case of viral infection. And so easy we can see if, for example, you have sore throat or coughing or something else, minimum what you can do, you can make this leukocyte formula test. And so easy you could see if increased general quantity of leukocytes and neutrophils inside of you, you will have bacterial infection. But if we are talking about increasing level of monocytes and lymphocytes, but general leukocytes not arise or not up so much, little bit, we are talking about viral infection. So it's so easy way for understanding what is going on with our body. Also important to say that monocytes, they moves to our tissues from bloodstream, from vascular system. They moves to tissue and staying there. They're named after transmission to tissue. They're named as macrophages cell. And their also main function there is phagocytosis. This is leukocyte formula under or leukocytes or all our blood under microscope. How can we see them under microscope? Under number 1, we can see with you erythrocytes. Under number 2, we can see with you thrombocytes or platelets. Number 3, 3A, it will be segmented neutrophils. Number 4, non-segmented or young cells neutrophils. Number 5, this general young cell. Number 7, eosinophil. You can see it's so nice pink color. And number 6, colored as a violet color. This is basophils. And the big number 8, small cell, is with so huge nuclei. It's named as lymphocyte. And this one, huge one, this is monocyte. That's all. Important to know that when something artificial moves inside of our body, this time we name this artificial body name as antigen, and our body try to fight with this antigen. As a result, after fighting, fighting our leukocytes. And interesting that first of all, starting to fighting with our infection or with antigens, this neutrophil leukocytes, which located in the peripheral tissue, not in the bloodstream, not in the blood. But when starting this fighting, they're sending signal, a humoral signal to the bloodstream for other cell, and this time other cell informed that needs some help, and there moves outside of bloodstream. Only one type of blood cells able to move out from bloodstream. It will be leukocyte cell. They this process name it as diapedesis, and their moves out of bloodstream moves to the source of antigen location, and there begin fighting. When happens this fighting, as a result of this fighting, releasing pus. Pus indicator of presence of infection in some our damaged area. When our damaged area is clear from pus, it means that beginning process of renew, and infection more not have this damaged area. Leukocytosis, general term which mean increasing number of leukocytes. If we say that maximum level is 9, when we are talking about leukocytosis, it means that it's higher than 9. And we have two types of leukocytosis. Here we have physiological leukocytosis or functional and adaptive protective leukocytosis. What does it mean? Everything, if we have combination word with physiological, it means normal. So it's fine. What does it mean here? Physiological leukocytosis, it means that increasing level of leukocyte for short period of the time. For example, it could be increased level of leukocyte for 3-4 hours, and after 3-4 hours, level of leukocytes turn down. Why it's happened? It's happened as myogenic leukocytosis after physical exercises, after some physical work. Second variant, after eating, it's food leukocytosis. That's why we say if we going to make blood test, this time we should make starvation before. We should not eating something and should not make physical exercises and should be quiet. For in our blood, we will measure normal level of leukocyte, real level. Because after emotional stress and during pregnancy, also level of leukocyte could be increased. And neonatal leukocytosis after birth, children's babies, they have leukocyte level higher in 2 times than normally have adult person, but it's normal for them. This is their norm for their age norm. What does it mean, adaptive protective leukocytosis? It means that because of presence of some infection, because of presence of some antigens, we have increasing quantity of new leukocytes. New leukocytes because of hematopoiesis. So physiological leukocytosis This we are not talking about creation of new cells. We are talking that leukocytes from around tissue moves to the bloodstream for some period, few hours, and they after will be back again to the tissues. But adaptive protective leukocytosis, we are talking about creation new leukocytes. Adaptive protective leukocytosis, we are talking about reaction of our body for presence of some antigens, a foreigner antibody in our foreigner's body in our our body. Organ of immune system. Here we are talking about primary immune organs. First of all, of course, it will be red bone marrow where we have hematopoiesis, and also here important thymus where we have specialization of T lymphocytes. Also important pairs, patches, appendix inside of our intestine. Here we have maturation of B lymphocytes. Also differentiation happen in lymph nodes and adenoids and tonsils. This is secondary organs of immune system. Immune system, if we are talking about classification of immune system, we should say that here we have innate or natural immune system and acquired or adaptive. What does it mean? I will explain you now. Innate or natural immune system, this non-specific system could be not improve, not have any memory, and they are doing immediate reaction. Innate or natural system means that each of us, we have the same mechanism of innate system. But when we are talking about acquired or adaptive system, this system is highly specific and develops in several days, not so fast, and could be improved after exposure and has memory. Both these systems we can divide on cellular and humoral. Innate cellular system, it will be granulocytes like neutrophils, and here we can say, and basophils and eosinophils little bit also. Here we are talking about monocytes and macrophages and natural killer cell. This is part of lymphocytes. When we are talking about innate natural humoral system, here we say about system of complement proteins, cytokines, acute phase proteins, and antimicrobial proteins. Acquired or adaptive system depends on cellular and humoral also, but how it's happened? When we are talking acquired cellular system, we are talking about T cells, T lymphocytes. T lymphocytes, they also have has specialization, and they divided on T killer, T memory cell, T suppressors, and T helper. This is a huge system of the cell, but they have high specialization. When we are talking about humoral acquired immune system, we are talking about result production of B cells. B, this is cells, B lymphocyte. They, when happened reaction with antigens, they transferring to special cells, which name it as plasma cells, and plasma cells produce in our blood, in our tissue, antibodies, immunoglobulins. Immunoglobulin, first of all, M after immunoglobulin G. I would like to show you one short video about reaction of leukocytes for presence of antigen. This experimental video made under microscope. In the surface with leukocytes, they put helminth, this small one worm, this helminth. And I would like to show you the reaction of leukocyte for the presence of antigen. The same way it happened inside of our body. Let's look. I think it's really cool because you could see now, right now, how is working leukocytes inside of our body. Also, you could see that this worm first, look, it's little bit, they first little bit understand something wrong. After so fast they move to each other because some chemical signal moves in the fluid and move through this fluid to all of this cell. And the same way it's happened inside of our body. And by the way, if in case of helminthosis, why we say that if person has helminthosis, it's usually this person has a weak immune system and it's usually have so often respiratory disease, some infection, and different viral infection, respiratory viral infection. Why? Because immune system of this person concentrate attention for the presence of helminth, and of course for other question not have forces. Next, this is way of working T helper cells, their activation, their action. First, antigen presentation cell, they receive it antigen, understand that something wrong there. Together with helper cells, they recognize antigen. A helper cell sends signal to the effector cell signal to the memory cells that learn already this antigen. Happen creation of interleukin induce activation of neutrophils, macrophages, T killer lymphocytes, and also send signal for B cell. B cell already learn what type of antigen came inside of our body and begin production of immunoglobulins. Immunoglobulins, look how they are working, these immunoglobulins, they find antigen sitting up, but they are specific, not every antigen, only for which antigen they are created. They are finding this antigen contacted to them, and what is interesting that they induce reaction of agglutination. What does it mean? For example, one antigen, another antigen, they will be like stick to each other and cannot move, cannot share other area, other tissue. And after huge macrophages will become here and will eating this complex antigen antibody. We have also a little bit other classification of immunity. We can divide it for innate immunity and adaptive immunity. Innate immunity, this from our mothers. I will show to you how is it working. And this non-specific immune system. But adaptive immunity, we can divide by natural and artificial. Natural could be active and passive. Active, if we catch some infection, our immune system begin to create a specific immune system. Passive, we are talking about some maternal, like immunoglobulins from mother can move to the children, to the baby body during pregnancy and during lactation. Artificial, we are talking about vaccination or immunization. It will be active artificial immunity. If we are doing some vaccination, we are create like education for our immune system. And other way, it could be passive antibody transferring. This is some way of treatment. For example, from the last situation with COVID-19, for people who was so sick and who had money, they have been treated by passive way, by antibody transferring. Antibodies created inside animals' body or inside humans' body who had disease and created so high level of antibodies. They gave their blood from there in medical laboratories, separated specific antibodies for COVID-19, and as treatment use it for ill people. Problem of the antibodies transferring, same like and with maternal passive natural immune system. Problem is the next that our body could not remember this infection, and next time if we treat ourselves by antibodies transferring, next time we can catch again the same infection. Let's look. Active immunity, natural. How is it working? Working by the next way. Some antigen, some inductor of infection moves in the human body. There we have primary immune reaction. Primary immune reaction, this first time when some infection, some antigen come in outside of our body, this reaction will be slow, not so intensive, because body doesn't know what to do with this infection, with this antigen, try to find some way of solution for treatment, how to fighting this infection, and finally finds the way. But the next time when we are talking about second time, if the same antigen will become to our body, we will have secondary immune reaction, and this secondary immune reaction is so intensive. Secondary immune reaction fighting infection so high that why as usually we even will be not ill, will be not sick, or this illness will be not so intensive how it happened from the first time. By the same way, by the same method, or on the base of this method, we have with you active immunity or vaccination. When we are using vaccinations, usually there we have weak antigen or part of bacterial or viral segments. But these segments, this part of bacteria or virus, they consist antigens upside their surface. And when these antigens comes to our body determine it like infection, try to learn what to do with this infection, and try to find way how to fight to this infection. And the most important that next time, if real infection will become to our body, real already, our body will give to us secondary immune reaction, absolutely intensive, will be maximum fighting how is possible for our body, and as usually we will be not ill, or our illness will be not so hard if we will not have with you immunization. Passive maternal immune system working, how I told you before, is working from mother's body during pregnancy to fetus or during lactation. It's working by the next way. A fetus is protected by mother immune system so long how it stay to be fetus. After birth, these immunoglobulins in the fetus body continue working during 3 months after birth. If women continue lactation and feeding by the milk of her baby, this time baby also receive all time these immunoglobulins. And if some infection will become to this baby's body, baby is protected by mother's immunoglobulins. What is the problem here? Problem is the next. It's working the same way how I told you about antibody transferring. When these immunoglobulins stay in the baby's body, they are working. But immune system is not developed this time, not growing, not learn something. And when mom stopped to feeding her baby, his body begin to be open for all infection, and immune system is not ready for that. That's why normally feeding is normal, minimum 3 months after birth, and physiologically it will be till 12 months after birth. Passive immunity, passive immune system. Here we're talking about how I say you before, about transferring of antibodies from some human's body or animal's body were created these immunoglobulins. And when these immunoglobulins finding antigen in the human's body, specific antigen, it will be treat this person. Next question, what we should discuss with you, it will be blood groups. Why is important to talking about blood groups together topic about immune system? What is important first? First, that according to medical and science community, nowadays we have more than 40 different type of blood groups. 40. But in medical practice, we're using only two classification. First, it will be ABO classification, and second one CDE or rhesus factor classification. By the way, Susan, do you know about your blood group? What is your blood group?
Oh, I'm not sure. I think B positive. I think so.
Be positive. Maybe it's you should know already. You should learn.
Yeah, I should look actually.
Yeah, it's interesting because you are in future you will be mom, so you should know your blood group. By the way, the most popular blood group is 0 or number 1. Please pay attention. So often students mix it And they thinking that because system name it as ABO, they thinking that A, this is first, B, second. No. First group is O group. Why? I will explain now. Second, A, third, B, and fourth group, AB. What does it mean? According to this classification, inside of our blood, we have two type antigen, A and B. For first group people, upside their erythrocyte, they not have not A, not B antigen. For group B, for group A, second group on the surface of erythrocyte antigen A, for group B antigen B, and for group AB, fourth group, and A and B. What is connection with immune system? Problem is the next, that time inside our blood plasma, we have antibodies, immunoglobulins, and in the group first O, inside of blood plasma, we have alpha and beta antibodies. Sometimes they are named as anti-A, anti-B, but real name alpha and beta. For second group, in the blood plasma, we have beta antibodies. For third one, we have alpha or anti-A, and for fourth group in the blood plasma, not alpha, not beta. Why is important? Because you can see that A group in the blood plasma has beta, B alpha, AB not have not alpha, not beta. Why? Because if alpha will meeting A or beta will meeting B, they will make complementary reaction agglutination. They perfectly pass to each other, and erythrocytes will make reaction agglutination. I will show you what does it mean. Here, you see, this time erythrocyte will be not separated from each other, but they will stick together to each other. And of course, if it will be happen in the blood of patient will be die, because this time erythrocyte are not able to working. When we are talking about blood transferring, we say that before in school program, as usually they say, we have universal donor and universal recipient. But it's not true, because in medical practice, already long time ago, transferring only blood group to the same blood group. So first group to first, second to second, and so on. Only from group to group. Second classification of blood groups according to DCE system or CDE system, right to say like that. Normally, most of people don't know that this system named as CDE, and they thinking that it's named at rhesus antigens or rhesus factor antigens. What does it mean? CDE system and small CDE system. This general antigens. But when we are talking about rhesus factor antigen, we are talking only about this one. Present or absent on the surface of erythrocyte. 85% people on our planet, they are Rh positive. So on our erythrocyte is present antigen D. And all blood group classified according present or absent this antigen D. And the same story happened. If in the blood plasma of people with antigen D have special anti-D antibody, anti-D. For rhesus negative people, anti-D in the blood plasma. For rhesus positive, not have this anti-D. And if rhesus positive erythrocyte will come to rhesus negative people blood plasma, again will happen reaction agglutination. And person after like this transfusion, hemotransfusion, will be die. Also important to know that sometimes happened rhesus conflict. Rhesus conflict, this situation which happened in the case if father is rhesus positive, but mother is rhesus negative. This case, if they will create baby, they have two options of baby. First option, baby will be rhesus negative as mom, and second way, it could be rhesus positive as dad. What is the problem? If mom is rhesus negative, but baby is rhesus positive, mother immune system understanding that inside her body some have antigen, some foreigners body, and immune system of the mom begin attack for this fetus. As usually, this attack happened not during the first pregnancy. As usually, after the birth of the baby, normally blood of the baby not moves to the mother body. And normally, if not have some damaging, not moves through the placenta. But if it's happened, it mixed contact mother and baby's blood will be problem for second pregnancy, not first. Second pregnancy, after birth of first baby, second pregnancy, mother body created already antibodies for this D antigen. And will be happen same way how we learn for immune system reaction. Will be so intensive immune system reaction, and before yet formation of placenta, immune system of mother will induce destruction of fetus, and as usually second pregnancy will not arise or will be not continue growing. Nowadays we have special treatment for like this situation. After birth of the baby, this woman will use special treatment, this name raw gum. It's named this treatment. And because of ragam, these immunoglobulins which created in the mother's body they will be destructed, and mother's body will be forget about these immunoglobulins, and the next pregnancy will be same way as first time. So every time after every pregnancy, if women have conflict with her husband, father of her baby, she should use this ROGAM, or maybe will be other one treatment. I don't know. Now I know only this one, which use it worldwide and use it for treatment this situation, and they can continue have children. So this is not so big problem, but before, like 30-40 years ago, it was a huge problem. One of the exam question, what you should know, this question tests which are to fulfill before the blood transfusion. What should doctor do before making hemotransfusion? First step, blood grouping of donor and recipient according ABO system. Second, according CDE system, antigen D rhesus factor. Third one, individual serological test on group compatibility. What does it mean? They're taking erythrocytes of the donor, and they're taking blood plasma of recipient, and under special conditions, they're looking under microscope is have reaction of agglutination or not have. If not have, we can do biopsy. It means that 15 milliliters every 5-10 minutes added in the body of recipient, and looking for the body reaction. They put 15 milliliters. This case, they are doing, they are watching, change it something or no. Not have, for example, tachycardia or blood pressure if fine, not have some reddish area on the place of putting hemotransfusion, and so on. If everything is fine, after 3 times this test, is possible to make hemotransfusion. We make 5 minutes break and starting new topic. Okay. Okay, and the other topic for us for today, we are starting topic human cardiovascular system. If you're talking about cardiovascular system, we are talking about system of transportation inside of our body. Transport system of our body, it will be a circulatory system or cardiovascular system, and also it will be lymphatic system. Lymphatic system, actually, according to anatomical classification, we can say that it will be like separated system. Lymphatic system has own capillaries and own vessels and has lymphatic nodes. But what is important and what should you know, that we have some place of connection between cardiovascular system and lymphatic system. This area where we have physical connection between all to this system, it will be subclavian vein. Look here on me, subclavian vein. This area where we have physically connection and lymph mixed with our blood. This area. That's why. Did you hear something about lymph drainage massage?
Massage? No.
Lymph drainage massage. It's very popular procedure for girls. So much like this procedure, because this procedure help for lose extra kilograms if we have this extra kilograms because of water or solute inside of our tissue. It's increasing metabolic process and take out extra water from our tissues. And how is working lymphatic massage? Working by the way that physically massager person pushing water and increasing circulation in lymphatic system, and all massage moves should be on the direction to this subclavian vein. If we are talking about massage of our face, it will be all moves will be with direction to the down. But when we are talking about our other part of our body, all movements will be moves to the up. But now we are talking about cardiovascular system, and we say that cardiovascular system consists of heart, capillaries, arteries, and veins. According to anatomical classification, by the arteries, blood moves out of the heart. By the vein, blood turns to the heart. In the capillaries, we have process of water and different substance exchange. General, talking about function of cardiovascular system, the function of the heart, this is pumps blood through the blood vessels, working like a pump. And blood vessels function, this transportation, they carries oxygen, carbon dioxide, and nutrients, and remove waste products from various tissue of body. Interesting to know that by 1 hour, it's general average, of course. By 1 hour, the heart is pumping 360 liters of blood. 24 hours, the heart pumping 10,000 liters of blood. For 70 years, pumping 200 million liters of blood. And during 24 hours, the walls of our heart have to open and close about 100,000 times. During the life of the heart makes 3 billion beats. Our heart located in the superior surface of diaphragm, left to the midline. Left to the midline. Heart is four-chambered, a hollow muscular organ, approximately the size of your fist. If you want to look what is exactly your size of your heart, you can look your fist and you will see the shape and size of your heart. Plus minus, it's the same. Interesting.
Yeah.
What else? If you are talking about function of the heart, we are saying that heart generating blood pressure, routing blood, and regulating blood supply. For normal function of our heart, you see that this so hard working organ, and for normal working need good own blood supplying, and own blood supplying happen because of coronary vessels. I saw like this picture, look please, this separated all heart vessels, and you could see it right now. We are talking that our heart four-chambered. It means that have 2 atriums and 2 ventricles. Sometimes you could see in some textbook that we can divide our heart for 2 parts, like left heart and right heart. Left heart, you see here on the picture with red color, because in the left part of our heart, always we have arterial blood. It means blood with oxygen. But in the right part of our heart, only with carbon dioxide blood, unoxygenated, without oxygen, as possible, maximum as possible. And important that blood from the right and left part in normal case should be never mixed to each other. Also important to say that on the border between atrium and ventricles, we have atrioventricular valve. On the way from the ventricles to the vessel, we have semilunar valve. These valves don't give to move blood in the opposite direction. So when blood enters to the heart, it always moves in this direction and never can be turned back because of the valves. If we will talking about construction of a tissue of our heart, we should say that here we have three layers. It will be endocard, it will be myocard, and it will be pericard. Also, around of our heart, we have epicardium, epicardial bag. If we are talking about muscle tissue, myocard of our heart, we should say that myocard created from cardiac muscle. Cardiac muscle so similar to a skeletal muscle, so similar by structure, but have difference because in the cardiac muscle we have special intercalated discs or gap junction. These special electrical contacts, due to working of them, all our cardiac muscle fibers working like one structure, like one cell or one functional unit. And that's why cardiac muscle named as functional syncytium, functional unit or functional syncytium. It's mean, interesting moment, that usually you have been studied first semester that one cell, excitable structure cell, working according the law all or none. But when we are talking about tissue like skeleton muscle, they already all of them not working according to this law because each of fiber has different level of threshold. But for cardiac muscle, for all muscle general, working low, all or none. So, or we have enough irritation for induced action potential in all of muscle, or we not have this potential. That is all. So all cardiac muscle, please memorize it and notice it, that all cardiac muscle working according law, all or none. If we are talking about physiological properties of cardiac muscle, we should say that general same properties as for every muscle tissue. It's excitability, conductivity, and contractility. But first one, this is special only for heart muscle. This properties is named as automatia. What does it mean? It means that our heart has capacity to generate action potential without any external irritant. Not need working of hormones, not need any stimuli from a nervous system for our heart continue to contract it, continue to pump. Maybe you have seen some video or movie, horror movie or some fairy tales where you can see that someone catches heart from another one person and takes this heart in the hand, and heart continue to beat.
Yes,
So
I have seen.
this is real story, because if heart is normal working, it's continue to beat even if person is die. For example, we can talking about traffic accident, and person can be damaged brain is stop working, person is die, but heart can continue pumped blood. And normally, if heart not stop, it could be continue work 3-4 hour minimum. This is interesting. Why it's happen? Because inside of our heart, we have conduction system of the heart. Conduction system of the heart. This conduction system working as EQ, and it generate electrical impulses by itself. Conductive system of the heart created from atypical cardiac muscular cell. This is not neural cell, it's atypical cardiac muscular cell. And conductive system of the heart consists of main elements. First, this sinoatrial node. Sinoatrial node located in the right atrium of our heart. Second one is named atrioventricular node. Next one, this bundle of keys or atrioventricular bundle. Next one, bundle branches. And last one, this Purkinje fibers. Purkinje fibers. All of this is conduction system of the heart. Important moment that each of these elements of conductive system can produce electrical impulses with different frequency. The main first node is sinoatrial node, primary pacemaker, primary. Average quantity of impulses which generate this node is 75 impulses per minute. For every person, same. For you understand how is it? I say you that every person plus minus nearly 75 impulses by minute created a sinoatrial node. But if we will calculate with you our pulse, heart beating, frequency of heart beating, we will have different heart beating, of course. Why? Or if we will compare our heart beating in state of rest and during physical exercises, it also will be different heart beating. Why? Because a heart can be under influence of nervous system and humoral factor, and nervous system and humoral factor will induce adaptation of our body for different conditions, or stress factors, or rest factor, or during digestion, all time heart beating changes. It means that our nervous system and our humoral factor can have influence on the work of sinoatrial node and induce adaptation, its work for our needs. But if first node is stop working, primary pacemaker is stop working, it's happened sometimes for example with age, for old people, or with some disease people. Second begin working second node, but second node is not able to produce same quantity impulses per minute. It's working less, generated maximum 50 impulses per minute. Next, bundle branches also can create heart beating impulses, but lower quantity, 30, 40 impulses per minute. And Purkinje fibers, maximum 15, 20 impulses per minute. Speed of transmission signal also different in different area of our heart. SA node, from SA node by atriums, signal transmitted as 0.5 meter per second. In AV node, we have with you AV node delay. There is like little bit stopped transmission of signal. For a what? This physically we have physiological explanation. Because if we are talking about a heart contraction, you can imagine this is our atriums, this is our ventricles. Heart working by the next way. First, contracted atriums, after atriums relaxed, and at the same time begin contracted ventricles. And for us important that first will be happen this procedure, after will be small delay for blood can be pumped finally to the ventricles, and only after we have contraction of ventricles. That's why we have delay in AV node. And after speed of transmission signal increase in a few time, bundle of his 2 meter per second, and bundle branches also Purkinje fibers 4 meter per second. So maximum quickly signal transmitted by ventricles, and ventricles are contracted. What else I will explain to you today? How is working this automaticity? How is working SA node and other part of our conductive system? How is working this automatium? It depends on specific creation of action potential inside of our heart. Normally, I will remind you, normally when we are talking about action potential in the muscle cell or neural cell, it's working by the next way. Happen creation of signal, we have reaching threshold, after depolarization, after repolarization. If not have new signal, will not have something new. But in the automatia, according to automatia, we have another way of action potential creation. Here we have 3 phases. First one phase named as SDD, slowly diastolic depolarization. This phase working in our heart through the T type of calcium channel. And also here is working another type of channels which name it as sodium funny channels. Funny. Why they're funny? Because normally sodium channels should be open, most of them should be open this point, this spot when we reach threshold level. But these channels working from the start of membrane rest potential. For example, -60 is MRP level. When we reach MRP level, automatically open T-type calcium channel and funny sodium channel. And calcium and sodium enter inside of our cell. Because calcium is plus charged, increasing our voltage, not increasing, more positive. From minus 60, it's reached to minus 40. From minus 40 will be open L type of calcium channels. L type of calcium channels. I will remind you that normally for action potential, here working sodium channels, here potassium. But for our conductive system of the heart is working, you see, calcium. And calcium L calcium channels will be opened and will be induce full depolarization. After will be happen same way how we know already. On the top of the action potential will be open maximum potassium channels and will be inactivated enter of calcium 2 plus. As a result, calcium will stop enter, potassium will move outside, and as a result, plus charge will be moves outside of the cell, and we have reaction of repolarization. How when repolarization reach the level of MRP, rest potential, automatically again open T type of calcium channels and funny sodium channels, and automatically will be again started depolarization. This way of automaticity of our heart because of specific calcium channels. And important moment here, what I want to underline for you, that our heart working of our hearts depends on calcium inside of our blood and our tissues. That's why for our heart working is maximum important calcium level. And if we will use, for example, more calcium, we will have with you tachycardia, increasing of heart beating. If we will have not enough calcium, we will have decreasing of heart beating automatically. But it's about regulation. We will talking about it little bit later. If we are talking about electrical process of our heart, the main method for measurement and registration of electrical process of our heart is ECG, electrocardiogram, or EKG, sometimes now use this, EKG or ECG, electrocardiogram. On the electrocardiogram, we are able to see, first of all electrical process, what are going on inside of our heart. And in this case, we have with you first of all, registration of conductive system of the heart, working conductive system of the heart. So when we are talking that I made ECG and I not have any problem with the heart, it's not true. If not have problem with ECG, it's perfect, but it means that only not have problem with electrical process. But possible that heart could have problem in mechanical question, problem with valves or something else, and it's not depends on electrical system of the heart. So my main sentence here is that ECG, this analysis which show to us electrical process in the heart. And first of all, according to ECG, we can understand if everything is fine with our conductive system, if not fine, where exactly the problem. I will not continue this topic today because it's a big topic. I will continue its next lesson, okay?
Okay, I understand.
Okay.